On this episode of Bondi Vet,
What the hell is that?
Ziggy has an extreme problem and solving it is going to be difficult.
You get that wrong and it's going to be bloody mess.
Can Lisa fix poor Ellie's bulging eyeballs?
I have never seen anything like this. Ellie's eyes look like they're basically popping out of her head.
What on earth has this snake swallowed?
It's huge and it's hard. But what the hell is it?
Okay.
Lisa can't cope when her puppy becomes a patient.
It's quite pathetic because I lose all sense of being a vet. I become a neurotic mother.
And will 60-year-old Hugo finally find love?
He's pretty frustrated. I mean, I think he needs a female.
You make my world a better place.
Yes.
He's walking with me.
I can't depend on you.
Fuzzy, look at the camera. Look at the camera.
At the Bondi clinic, Quinn and his unusually colourful golden retriever Buzz are waiting for Chris.
What's happened here? I'm racking my brain thinking, is there some rare contagious disease that causes blue, yellow, red, multicolours across the face? Yeah, textify. Who's this?
Buzz.
Buzz.
Lightyear.
Ah, so you want to make him blue, like Buzz. The rare contagious disease that Buzz is suffering from is school holidays. Is he pouring in his mouth as well?
Yeah, we had ribs on Friday night, so we've been feeding him the leftover ribs. So he's got one wedged right across his back teeth, across his top palate.
I'm thinking that Buzz should be the hairdresser trying to get a tint to change that colour of his, but no, it turns out there's a medical problem here. I'll try to get my finger underneath it and flick it out, but it's in a tricky spot.
But it's not actually the first time it's happened. So he's a very pretty dog, but he's not very smart.
Oh, bro, you look like you're gonna break it.
No, that's not working.
It's pretty firm, isn't it?
It is, yeah. It's so firmly stuck, it's not going anywhere. It's either forceps or Buzz is going to need a sedation. It should be fairly simple. Not yet.
I'm gonna die.
There we go.
Oh, well done. Yay.
The moment I flick that bone out, Buzz thinks, well, bone is bone.
Don't eat it again.
You just... No, don't. Come on. It's almost as if Buzz is trying to create more medical drama for himself, just so, well, he doesn't have to go home and face Quinn. No, you had one go, it didn't work out, so let's not go again. Buzz is probably only a year old, but he looks 8. He's been through so much trauma. Are you going to ride him out, are you?
Yep.
Gently now, gently.
Good boy.
Enjoy. Buzz, if you're watching, there's a thing called Christmas holidays. They go for about 6 weeks. When you see that tree being put up with all the sparkly things on it, run away, quickly. Don't look back.
Another patient with a rather embarrassing condition is on his way to see Chris.
Hey, how you going, Neil? Yeah, I'm good, Liam.
His bemused owner, Lee, was a former vet nurse at the Bondi clinic.
What we got happening here? Yeah, he's got a little something growing on his leg here. Wow.
It's like almost, it sounds a bit funny, but like a third testicle swinging in the wind there. It's just so big.
It's definitely one of the strangest things I've ever seen. People were just standing at the lights going, what the hell is that? Makes you feel like a neglectful dad. Ziggy, come on, this way, boy. Come on, let's go.
What the hell is that?
This is a little something that's been growing for a bit over a year, I think.
A year?
Yeah.
How can you...
Well, you know, it started off a little small and then Just kind of escalated a lot.
And suddenly, since it's got a lot bigger recently, the weight of
It's gotten a lot bigger, yeah. You can see the sheer volume.
I'm trying to be serious and maintain my professional integrity, and all the while I'm just thinking, well, look at that thing. What is it? It is like a Chihuahua speedball, isn't it?
It really is.
You could start your own Chihuahua gym and sit there just going whack, 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 whack. It is almost comical, but it could have a very serious side to it. You can actually see he has actually been banging it on things. Does he seem in pain with it? Does he ever yelp out with it?
No, it doesn't. He never ever complains at all.
While it looks like a cricket ball in a stocking, it feels like it's full of fluid, which to me is quite reassuring, because if it was just a mass of tissue, I'd be quite worried. The very real risk here is that that lump could actually get caught on something when Ziggy's walking past it. That'd be nasty. It's probably not going to surprise you too much when I say to you this has to come off.
Yeah, I was actually hoping it would.
I'll open it up once I've taken it off and have a quick look. But I guess the hope is that it isn't anything too serious.
Okay.
Good boy.
Strange cases are also showing up at the Bondi Referral Hospital SASH.
It was a surprise when we saw it. It looks like she's sort of seen a ghost or something. It looks really terrible.
2-year-old Ali has been brought in with unusually bulging eyeballs.
I don't like the thought of any, problems with blindness. We wanted to get it fixed up straight away.
I must say I've never seen anything quite like this. Wow, that's unbelievable. When did this all come about?
Probably a week ago.
Okay, and what happened?
She just started to get a little bit of white knock in the corner of
Oh,
one
she's
eye.
looking at me so startled.
I know, it's a
Pretty
bit of a
bizarre.
shock, isn't it?
I've seen animals that have inflammation in other parts of their muscles, but I've never seen it affecting the muscles around the eyes. I know if it was one eye affected, then I wouldn't be as shocked, but the fact that both eyes are like that, I mean, she looks like a Google-eyed fish.
She does, yeah, she does.
She doesn't seem to be in any pain. She seems like she can see. I really need to get an ophthalmologist to have a look at this one.
Off you go. You're all right, Elle.
Come on, sweetie. Look, I see another doctor.
What do you reckon about that, Lisa?
I've seen them bigger.
They get any bigger than that.
Well, maybe not on dogs. Can't say that on TV, can I?
The gigantic mass hanging off Ziggy's back leg needs to be removed for his safety, as well as for his looks.
I've seen plenty of lumps that have taken my breath away in terms of how big they are, but I've never seen one that could trip the dog over. It's extraordinary. There is a risk that this is a tumour, but the way tumours, certainly nasty tumours, normally behave is that they invade into the body. This one is making a drastic attempt to get as far away from the body as possible. This is interesting. We've got the big vein coming along here, and it disappears once it hits this lump here, and then reappears after it. It's quite possible that whole lump is actually a blood vessel that's had a massive blowout and just continued to expand. And as more blood has come into it, it's got bigger and heavier and just started to drop off the body. This might actually be a little bit more tricky than we thought. And the worry I've got now is that we've got a major blood vessel that I have to cut through and around. You get that wrong and it's going to be a bloody mess.
Look at this dog's eyes.
Oh my God, you poor sweetheart.
At SASH, Ali's bulging eyeballs are becoming the talk of the hospital.
Hello, darling. Do you know what it is?
No, I'm going to go try find Kelly and see if she can tell me. I've never seen anything quite like it. What do you think of the eyes?
It's a bit scary,
Amazing, it is.
That's a real bug-eyed dog.
Like a Google-eyed fish. It's me. This is actually a really interesting medical case. I've never seen anything quite like this.
Miss Ellie, do you think we could take a look at these eyes of yours, huh?
Fortunately for Ali's feelings, eye specialist Callie Caruso isn't as shocked as her colleagues.
She's got a nice response to the light. Well, I think the key with her is her age and her breed. And this is the immune system attacking the muscles that surround the eye, inflaming them and making the eyes bulge forward. An extraocular polymyositis. What these dogs typically present is non-painful, visual. They look really kind of creepy, but we usually can fix them, and we can put her on some oral steroids and a little lubricant in these eyes, and I bet she's a new dog.
These little blue tablets are going to make her look a lot better within about 72 hours.
Oh, great.
Which is a pretty quick turnaround.
It is.
She says, I will be beautiful in a few days, Mum. I promise I'll have my beauty back.
You're beautiful anyhow, aren't you?
I will never forget that look of surprise on Ellie's face when she walked in the door with her eyes bulging out of her head.
See you later. I'm just glad to find that they can treat it. So that was a good thing. A really big load off our mind. She'll probably get a big cuddle, big hug, maybe a treat.
You can really see that vein now.
At the Bondi clinic, Chris has begun removing an extraordinarily large mass from Ziggy's leg. The problem is he has to navigate around a major blood vessel.
I'm getting through a few small ones, but sort of the elephant in the room is that big vein that's still hanging out there. I'm just going to leave that till last. Anything this big is always going to have a really good blood supply, so if I even nick the big one, you guys will know about it.
After an hour, Chris is becoming more confident that the vein causing so much concern may not be attached to the cyst.
So I think I can actually get the lump off without even having to cut into the vein, which is a bit of a blessing. There it is. Honestly, I'm actually quite relieved that operation's over because it was a lot more touch and go than I thought it would be. People are watching, waiting.
Samples of the mass will be sent to the lab to make sure it's not cancerous. Ziggy, meanwhile, will be staying at the clinic for a sleepover.
You wait until you see what I've done to you. It's good. It's really good. You ready to go to bed? You look like you could sleep it off. Yeah, that's what I thought. How you going, Dad?
I'm fine, thanks. Are you close to home?
Yeah, I'm pretty close now.
While Ziggy recovers from his operation, Chris is heading north to Newcastle to visit his mum and dad.
Well, is there any chance that you could make a detour?
Why?
Well, listen, Tom from Wise has contacted me and he needs someone to help him out with a snake that's in a chook shed.
It doesn't sound like much of an emergency, though, a snake in a chook shed.
Well, he reckons you might find it interesting when you get there.
Yeah, well, okay.
Okay, thanks, Chris.
Bye. Unbelievable. What? I get home so rarely, and then the first opportunity I have to do it in so long, and Dad sends me in the opposite direction. Dad hates snakes, so this all makes perfect sense. How convenient.
It's another 2 hours before Chris finally reaches the farm where a surprising situation awaits.
Hello, hey Tom.
It's really good to see you again, Chris.
I was expecting some sort of drama. What's going on?
There's Michaela, there's Bob, they're the owners here.
G'day, mate. Good to see you.
They had an unexpected visitor in the hen house today, and we've got something up there we'd like you to have a look at.
Good boy, aren't you? What is that? My first reaction when I see the python is he's a big boy, but then straight away you're drawn to this lump. It's huge and it's hard. What the hell is it?
I think it's a marble egg.
A marble egg?
Yeah, yeah.
What, they're laying marble eggs in here now?
Yeah, right. Now, we put them in there to encourage the chickens to use particular boxes because they all crowd into one box. So we put in a fake egg, and I think he's eaten it.
You're kidding me? Python was just doing what pythons do. They go looking for meals. So he's come on in here, looked for a few eggs, then found the mother lode. You want this back?
I'd like it back if I could, please.
Michaela's sister gave her the egg as a gift.
It's about the size of a duck egg. I think it's about that big.
Been trying to think of a name for him, and the one that really makes sense to me, Rocky. It's just because he's obviously got a fight in his hands. That's the only reason. There's a lot of joking around, but medically, this is quite serious. I would have hoped that this python may have even had a chance at regurgitating this egg back up, but now looking at where it's lodged, it's just too far down. Even with all the great forceful digestion these guys have, all the enzymes, you can't break down marble. My feeling is it's going to be really hard to avoid surgery here because that egg can't get out any other way. And if it was to stay there, it's going to block up his digestion, it's going to cause a lot of pain, and it will eventually kill him.
Emergency vet Lisa Chimes is worried about her puppy, but she's putting on a brave face.
Today is Lucas's big day. My little boy is getting castrated. And for most dogs, this is a fairly routine procedure. But for Lucas, he's got a rare condition called cryptorchidism, which basically means that his testes are missing. They haven't dropped down. Now, if we don't go in there and find them, he's got a 10 times greater chance of developing cancer, and that's pretty scary. Yeah. It's quite pathetic because I lose all sense of being a vet. I become a neurotic mother, and I've been worrying all night about him having the surgery today, and it's quite embarrassing, but unfortunately I am really, really worried about today. I was kind of hoping that Lucas would be that really rare dog where they drop after 6 months old. I don't think it's going to happen. Hey, it's now or never, isn't it, Lukey? Want to go walkies? Yeah! Go for walkies? These boys are really, they're my life. And for them to be in pain or go through any risky procedures just freaks me out. Let's go. He has no idea what he's in for. Hey, let's go. Come on.
Chris is a long way from Bondi Beach. He was meant to be catching up with his parents in Newcastle. Instead, he's now on a mercy dash into Coffs Harbour with a deformed snake that has managed to swallow a large marble egg.
Drove gently.
Tom from Rescue Group Wires has arranged for Rocky the Python to be x-rayed at Pacific Vet Care.
He's in pretty good condition, really, isn't he? Yeah.
He's so
healthy.
shiny.
Yeah. Very healthy.
You can actually see the outline of it there.
So you can see the other eggs that it's eaten.
Yeah. Wow, there's no doubt what was going on.
So, 2 small eggs and 1 large.
It's a lot bigger than I actually thought it would be. And it's probably pressing on his skin and the wall of his intestine and stomach probably a bit more than I'd hoped it would have been. So this is now probably a bit bigger deal than we thought.
Rocky needs to go under the knife immediately.
The one main weakness of reptiles is stress. They don't really handle it too well and can mean you can actually lose them under anaesthetic or after the operation.
The problem is getting them asleep. Once they're asleep, hopefully it will all go okay, but then you've got to wake them up at the end as well. The quicker the surgeon is, the safer it is for the animal.
I'm a mess. Is he being braver than you are? I'm pathetic.
Lisa's puppy Lucas is about to undergo surgery to try to fix his rare condition, cryptorchidism, more simply known as missing testicles.
Oh, be brave.
Good boy, good boy.
Surgeon Andrew Marchevsky has the unenviable job of operating on his colleague's beloved dog.
He's got nothing.
There's nothing.
No. The problem is when they're as you know, when they don't come down, they stay really small.
Yeah.
And they're really hard to find.
Yeah.
And his were never going to be big in the first place.
Lisa does have another concern. It's just a little bit embarrassing.
I have this worry that maybe he could be a pseudo-hermaphrodite. Now, don't laugh.
Hermaphrodites have the reproductive organs of both males and females.
I'll tell you the reasoning for this.
Right.
Male dogs in the park have been having relations with him. Could it be possible that he's releasing some female hormones?
Well, I guess it's possible.
So maybe when you're in there, if you want to just have a look for some ovarian-looking tissues.
You're right. Maybe he's been enjoying the attention.
Poor Lucas, you're just a special little boy.
Snakes have a habit of twisting under anaesthetic. The way you prevent the twisting is tape them to a board.
At Coffs Harbour, Chris is about to start surgery on Rocky's alarming bump.
The big test will be whether he'll feel the incision.
The python swallowed a marble egg, which, if not removed immediately, will shut down his system and kill him.
The tricky thing is, it's going to be a decent-sized incision to remove something that is so huge. Here we go. Just a blood vessel sitting exactly where I don't want it to be, just right where the incision is, so just having to do a little bit of a sidestep around that. Just very conscious of the fact that blood loss is a big issue with snakes and surgeries, and with Rocky already being under stress here, we've got to be especially careful with that, so it's all about keeping bleeding to an absolute minimum. I can feel it on my scalpel blade. I've hit something that isn't snake, it's stone.
Finally, Chris sees the marble egg that has landed Rocky in so much trouble.
As any good chicken knows, it's hard to pass an egg, so this is going to be a little bit tricky to get this out.
I have to castrate and love him. Don't hurt him. I'll do my very best.
We're all right. We're not going to cry.
At SASH, Lisa's puppy Lucas is on the operating table and surgeon Andrew Marchevsky is feeling the pressure.
Well, it's a lot more risky than if it was just a straightforward castration because we might have to open him right up.
Lucas has a rare disease called cryptorchidism, which means both his testicles are missing.
I think I've just caught sight of it near somewhere.
If they're not found and removed, it greatly increases the risk of cancer.
I've got the first one, so that's a good start. We'll just get it tied off. Got to be a little careful because there's a couple of little vessels around here that if you nick them, they can bleed quite a lot, and I don't think that'd please Mrs. High Maintenance out there. I can't find the second one. It's hiding from me. So it's making my life a little bit more difficult. I'm going to have a late lunch. I found it. Is it there? It's there. It's sitting just near the bladder. So it sort of got 3/4 of the way that it should have got and stopped. Ran out of puff. Good news for Dr Chimes. I can confirm there are no girly bits, so Lucas is definitely a boy. It's a boy.
It's a boy!
It's a boy.
He's a boy now.
So Lucas is not an hermaphrodite. That's the good news. The bad news is not going home tonight.
Oh, yeah, right.
He's staying overnight.
No, I'll be taking that
He's
trip
staying
pump
overnight.
home. That pump will come home.
Staying overnight.
Can I see him?
Yeah?
Yeah.
You can see him.
Okay.
Come on.
Oh, little Lukey. Oh, baby boy. I feel like I'm an owner. It's really bizarre being the one getting all emotional, saying goodnight. Complete role reversal for me. He's a sleepy boy. I've been putting this off for so long, and I'm just so happy that it's over and I can now look forward and he can recover and it's all in the past.
Got a present for you. They're quite big. They're not bad. Lucas.
Excellent, I can prove to everyone that he is a boy.
There we go. One marble egg with African pattern with a beautiful zebra featured on the front of it.
At Coffs Harbour, Chris has just removed the cause of Rocky the Python's bizarre bulge.
The thing that really surprised you is just how heavy it is. It's really solid and really heavy. And potentially for Rocky, this is actually the most dangerous part, because if he was to actually have some sort of leakage from this wound here, then that's going to cause a serious infection and it'd be enough to kill him for sure. So this is the last stitch here. The hardest thing right now is the waiting. We've got through the surgery, everything's been done, and now we just want Rocky to spring back to life, and that'll make me feel better, but now it's just nothing going on. Just give me something. You all right?
It's now been 3 hours since the surgery finished, and the python still hasn't woken up.
He's cold, so his whole metabolism slowed right down. If we can speed up his metabolism, he's going to wake up a bit faster.
And then, the sign everyone has been hoping for.
There we go. He's just starting to curl up his tail here now, so it's our first signs of real life here.
Look at that. Oh, Rick.
Hey, buddy. You're waking up. Everyone's happy. Tom.
Hi, Chris. How's our patient?
One slightly slimmer snake.
Oh, look at this.
He's still a little bit groggy. He looks great. And one slightly used decorative marble egg.
That's remarkable.
Is that something? The fight's not over for Rocky because he has to get through the anaesthetic, recover from that tonight, and then tomorrow really focus on healing internally.
Thank you very much.
That's all right, mate. But tonight really decides whether he has a great future or not. See you tomorrow.
See you tomorrow. No worries.
Okay, cheers.
Next day at SASH, the curious cases continue. Deb and her daughter Meg have brought in their 5-month-old kitten.
Oh, Lily, it's all right. Lily Pilly.
The family adopted Lily only 5 weeks ago, and 12-year-old Meg is already in love.
This much. I love her a lot.
But now her new best friend is in real trouble.
Well, she's eaten a rubber band about that size, I think.
Ooh, that's quite a long one.
It was around a bunch of flowers, and as I was opening the flowers, it flicked off and she pounced on it.
Okay, so you can see there it's not under her tongue.
No.
The problem with leaving it in, if it's as long as that, and she's chewed it can cause the intestines to sort of all bunch on top of each other, and it can be a really nasty obstruction that can be life-threatening.
To avoid invasive surgery, Lisa will first attempt to make Lily vomit up the rubber band. But for cats, this can be a tricky procedure.
They just don't respond to the medications in the way that dogs do. Yeah. So it's a bit of a nightmare. Can I ask as well what type of flowers they were?
Ah, lilies?
Lilies cause kidney failure in cats.
Really?
And any part of the plant is toxic. Most of the time we can't get them back from that.
Oh,
okay, so it's actually better for her that she's eaten the rubber band rather than gone and had a nibble on the lilies.
Okay.
Good luck.
Take care, good luck, absolutely. Throw up well.
I had no idea that it was this serious. I just thought, oh yeah, they'll just give her a tablet and out it comes and off we go. Had no idea. that it would be like this. Yeah.
Oh, so brave. Good.
Lisa's now giving Lily a sedative shot to try to make her vomit. If she doesn't, the kitten will need to be cut open.
Come on, little one. I know it's horrible. I feel really mean. Come on, little one. Come on, licking the lips. Licking the lips. A big vomit, please.
In reception, Deb is trying to calm down the very worried Meg.
I was scared that she might not be coming back. And before, when I gave her a kiss and bye-bye, good luck, that might have been the last goodbye to Lily that I would have with her.
Hopefully it's not going to be that grim.
No, let's hope not.
Hopefully they know what they're doing in there.
Yeah, I reckon they will.
We don't want you to have surgery. You're only a baby.
An hour later, and still no action. The question now is whether the kitten is going to listen to Lisa or cause herself a whole lot of pain.
It's the easy way out. It's much easier than going under the knife.
Tom?
G'day, Chris, in here. How you going?
Hey, mate, how you going?
Good, how are you? Good to see you.
I'm nervous, mate, OK? That's how I am.
I understand.
It's been less than 24 hours since Chris removed this large marble egg from Rocky. Without emergency surgery, the python would have died.
Look, mate, I'm really happy with how that looks.
It's nice and clean. He's been fantastic. He's had more sleep than I've had, and I'm tired now.
Oh, he's going back to the favourite position, the blue hand position, he calls it. Just trying to finish me off once and for all.
Chris's unusual rescue mission in Coffs Harbour is almost complete. There's just one last matter to attend to.
Oh my God.
That's it, right?
Yeah.
It looks a bit different.
What did it look like before?
I think it was orange.
It was orange before.
It's not pink.
Jeez, what?
It is quite different.
Is that a
actually.
stomach acid?
Yeah.
Yeah, that's amazing. I was really happy to have this back, but more importantly, I'm happy that Rocky's actually survived this.
As much as it pains me to say it, Dad was right. I don't think I'll ever see a snake with that sort of problem ever again.
You've got to feel worse before you can feel better. Hey? You're a naughty little thing. It wasn't a lizard.
At SASH, Lily is running out of time. If she doesn't regurgitate the rubber band she swallowed, the 5-month-old kitten will need surgery to prevent a fatal blockage.
A big vommy.
Finally, some encouraging signs.
Come on, good girl. Good girl. That's a girl. Oh, I'm sorry, my sweet. Oh, and there's a rubber band. Yes, there is. Woohoo!
Success.
Success.
Yeah.
Well done. But seriously, that is a long piece of rubber in a cat of this size. That could have been really bad. She's a one-hit wonder.
Oh, hello, Lily.
Now Lily just needs rest and love from her family. As for little Meg, she can stop worrying.
Hello. Feeling better now. I'm just so happy. Big relief. Yeah.
I need you to come and have a look at Hugo. He's our male Galapagos tortoise and he's just coming into his sexual peak.
How old is he?
He's 61.
He's 61.
Next day, Chris has arrived at the Australian Reptile Park to help out with a very intimate investigation.
He's never had a girlfriend.
Never?
Never. We have to get him a girlfriend.
It's one hell of a drought.
Well, he has to pass this test.
What test?
Well, we need to know if he can make babies.
Fertility test. In a tortoise.
In a tortoise. Galapagos tortoises are pretty rare, in captivity and in the wild for that matter. But to get him a girlfriend, we may have to go international. And you wouldn't want to do that if you could find out in advance that he wasn't able to make babies.
Hugo's been looking for love in all the wrong places. He's fallen for a goose called Lenny, and he's also crazy about his keeper, Julie.
Yeah, at the moment he thinks that I'm his girlfriend, so which is it's nice, I suppose. It's a bit flattering, but at the same time, it'd be really nice for him to actually have his own real girlfriend.
With no female tortoise in sight, Hugo's a frustrated bachelor.
All of the rocks within his yard that even slightly resemble the shape and size of a female Galapagos tortoise, he's being a bit naughty with them.
You're a good-looking man, Hugo, aren't you? You've got that sort of dignified, mature look.
He thinks you're a rock. He's pretty frustrated. I mean, I think he needs a female.
You've almost got to feel sorry for him. It's pretty cut and dry today. If he isn't fertile, if he can't be a dad, then there's no girlfriend. Ever. I think there's a sample.
Oh, quick, get it. Yeah, mate, in you go.
You serious?
You got it?
Yeah.
Enough?
Oh, yeah.
Oh, look at that. Put that under the microscope. Let's see if they wiggle.
So, mission accomplished. Future generations of Hugos really are going to be decided by what's in this jar. And also his happiness.
I'm actually a bit nervous.
Well, I've got my fingers crossed. It's a lot riding on this. Like the expectant father, Timmy.
Yeah.
What I'm looking for in this sample is, first of all, that there are sperm in there, but secondly, that those sperm are able to move, that they're swimming strongly. If they're doing that, and if there are enough of them, then Hugo's classified as being fertile, and it can be a dad. We're moving here. Little Hugos.
They are?
And so they're trying to get somewhere.
Yeah.
They're little guys in a hurry. And they're Hugo's little guys in a hurry.
Yeah, I'm so happy for him. Hugo, you get your girl, mate.
Good times coming up, Hugo.
Now Tim has to get busy on the internet to find out just what suitable candidates are out there.
I don't think he's going to be too fussy about which girl turns up. But it's very important that they are unrelated to Hugo. So they're managed by a stud book, and that says which girls, regionally or internationally, are most suitable for Hugo, and they will be the girls that come.
We won't tell her about the rock either. That's our little secret. That might scare her off a bit, actually.
You ready? Got it? You got it?
As for Ali, have the tablets fixed her extreme case of bulging eyes?
Oh, 100% better. Thank you. Didn't look too good before, but she definitely does now. Yeah, so it's nice to see her eyes back where they should be now. Hopefully they'll stay there, and hopefully we won't have any more problems.
Barbara's a happy owner. Ali's looks are back, and life is good with her best buddy Riley.
Oh, you're a beautiful girl, aren't you? You're a beautiful girl.
Later that day, back at the clinic, Ziggy's trying to give Chris a message.
Hey, Zig. You're missing something, aren't you? Yeah, you are. You're missing your little mate.
That massive cyst has gone, and the new improved Ziggy is ready to be reunited with Lee.
Hey, Ziggy!
He's come through really well.
Fantastic.
Not only did you get Ziggy home, you actually get
Oh, you did keep it for me?
the very special gift that you were requesting.
Fantastic.
So,
Oh, that's disgusting.
As for the biopsy results, they're all clear.
People are going to stop staring at him. I'll stop being embarrassed. He'll probably stop being a bit embarrassed as well, which is good. Good for his confidence.
Lucas also has reason to feel confident. His delicate operation has proved once and for all he's all man.
Where's that dog on television?
Now he's back home with Lisa and Nelson watching his favourite TV show.
These boys, they're my life. They're my children. I would do anything for them.
We've got some candidates that he can have a look at.
that's why you got the laptop.
Yep.
You're matchmaking online.
Yeah.
You serious?
Yep. Well, we can show him. Here you go.
It's been several weeks since Hugo's fertility was confirmed.
Look.
Tim's been searching far and wide for a suitable mate.
This is Shelley. She's 52 years old, and we believe that she's looking for love.
Oh, I think someone else is looking for love
She
too.
likes long walks along the beach and moonlight cinemas. She's never had a boyfriend in her life, and we think that she would be perfect for you.
So now we begin negotiating and we get Hugo his girlfriend. Could take a little while because these things, you know, take a while in the process, but what a day.
If they could see you now, you'd be getting nothing, I promise you.
Oh, Hugo, settle down. In the meantime, it's only the best food, only the best conditions, and we get him looking handsome for her arrival.
You imagine when Hugo sees her, she needs to be warned.
Hi, I'm Dr Kate, and if you enjoyed this video, make sure you subscribe to the Bondi Vet YouTube channel. Click on the screen for more great content. And for free, exclusive, never seen before Bondi Vet stories, you can sign up to bondipet.com, and you can do so via the link in the description.